So what I want to do when I see a patient, I want to inform, set boundaries with my patient based on mutual trust and honesty. I want to set these boundaries before I write the first prescription. If the patient goes outside those boundaries, I want to sit down and talk to them and find the motive behind their behavior, and then I may tighten the boundaries a little bit. And if they go outside the boundaries again, then I may have to bring in the appropriate healthcare specialist, whether addiction specialist or mental health specialist, to help the patient with the coping skills. I don't want to kick the person to the curb. I do not want to do that, because that only circulates the problem in my community. I want to give that patient every opportunity to get their life together. So what I want to do is, if they go outside the boundaries, tighten the boundaries, bring in whoever I need to bring in. And let's say I do a urine drug test, which I do on all my patients. I do urine drug testing on all my patients, and randomly, no matter who they are throughout the year, maybe depending upon the clinical status, determines how many times I do it. But let's say I find cocaine in my patient's urine. Does that negate their pain problem? No, I don't. But I bring that patient in and I have a discussion with them. And I said, I made 2 additional diagnoses. They said, what's that, doc? I made the minor diagnosis of cocaine abuse or addiction. And notice I said the minor diagnosis of cocaine abuse or addiction, and I made the major diagnosis of an honesty problem. How could I treat you with a controlled substance if we have an honesty problem? And are you willing to work a program for recovery from this cocaine abuse or addiction? And it's the patient's choice whatsoever. They could tell me, doc, I'm not willing, I'm not ready. And I say, well, then you have a nice day. You have a nice day. If you're willing to work a program, then you come back. But if the patient uses my medicine and diverts it to the street, which is a felony, I believe that that trust has been broken, and I will not take that patient back in my practice. And by HIPAA laws, I am not, if the patient uses fraud, deceit in order to obtain a controlled substance, or traffics my controlled substance, that's a felony. That immediately breaks the doctor-patient relationship. I have no further relationship with that patient. I don't give them a supply of medicine, nothing. I can report those patients to the authority, but I'm not obligated to report those patients to the authority. So in conclusion, healthcare professionals can prescribe a scheduled controlled substance approved by the FDA, consistent with state and federal regulations, to give their patients the best quality of life possible given the reality of their medical condition. Now, in the beginning of my talk, I told you about my accident. I told you about how I progressed, that you're seeing me in my 3rd life. And I also gave you the information that I was in a wheelchair for essentially 90% of the day for the last 20 years until February. What has changed that allows me to stand in front of you and walk just like a normal person? Well, I had deep brain stimulator placed on December 19, 2007. And a couple months later, I was walking with my granddaughter, Lily. And my grandchildren have only known Pop-Up in a wheelchair, only known Pop-Up when he got up being crooked and dystonic and distorted. But that was Pop-Up. They had no problem with that, because that's all they knew Pop-Up from. And they passed the handicapped spot. They said, that's where Pop-Up sparks. That's Pop-Up's place. So I was walking with my granddaughter, who's just last week was 5 years old, but she was 4.5. And she's walking with me, and all of a sudden, she noticed something different. And she looks up at me and says, Pop-Up, you're not crooked anymore. She did a visible physical exam. She also said, this spontaneously, your boo-boo is getting better. She did an assessment of my pain generator. And last and not least, she said, that means you could play with me more, right? She did assessment of my future functional activity. Wisdom from Lily. If Lily could do this in 4.5, at the age of 4.5, and do my evaluation in about a minute or less, we as healthcare professions could do a better job and take care of patients who have chronic pain. We could do a much better job to give these patients a better quality of life, which are good patients with complex medical problems. They're not bad patients with complex medical problems. I always like to end my talk with the AA Serenity Prayer. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. Folks, from the beginning of time to the end of time, there'll always be criminal activity. Never stop. From the beginning of time to the end of time, there'll always be the disease of addiction. And unfortunately, from the beginning of time to the end of time, there'll always be acute and chronic pain. We have to accept these facts and treat these good people with complex medical problems. Because as we go further on in this century, we want to go 2 thumbs up for good pain management and to improve the education of all the stakeholders. If this gentleman could do better and beat anorexia, we could do better in our pain management. And last but not least, we want to shoot higher and higher in our goals of good pain management of patients who have this chronic problem. And with that, I thank you, and I'm willing to take any questions that you might have.